Hello everyone, I am Dr. Radhika Purandare. I am working as a radiologist and fetal medicine consultant in Momstory Hospital. Today I am going to talk about NIPT, that is Non-Invasive Prenatal Testing. NIPT is a screening test for detecting genetic anomalies in the fetus. It is also called as a non-invasive prenatal screening or cell-free DNA test. The test is non-invasive and involves taking a blood sample from the mother. It has revolutionized prenatal care and has become a popular choice for expectant mothers. In this video, we will discuss the benefits and limitations of NIPT. So how NIPT works? NIPT analyzes fetal DNA present in the mother's blood to detect genetic abnormalities. The test can detect chromosomal disorders such as Down syndrome, Edwards syndrome, and Patau syndrome. It is highly accurate and has a low false positive rate. However, it is important to remember that it is a screening test and not a diagnostic test. NIPT is recommended for pregnant women who are at higher risk of having a baby with chromosomal abnormalities. This includes women over the age of 35, women with a family history of genetic disorders, and women who have had an abnormal ultrasound or other screening tests. So what is the accuracy of NIPT? Studies have shown that NIPT has a sensitivity of over 99% and a specificity of over 99% for detecting Down syndrome, which means that it is highly accurate in identifying pregnancies affected by Down syndrome. The accuracy for other chromosomal abnormalities such as Edwards syndrome and Patau syndrome is equally high. So what are the benefits of NIPT? NIPT is a non-invasive test. So it is non-invasive, so that poses minimal risk to the mother and fetus. The test is highly accurate and can detect chromosomal abnormalities earlier than the other screening tests. So what are the limitations of NIPT? It is a screening test and it is not a confirmatory diagnostic test. A positive result doesn't necessarily mean that the fetus has a chromosomal abnormality. In such cases, invasive tests such as amniocentesis is required to confirm the results. Additionally, it is not a test for all genetic disorders. Single gene disorders like cystic fibrosis, sickle cell anemia, then microdeletions and rare genetic abnormalities cannot be detected. So NIPT results can be useful in genetic counseling sessions as they can provide important information about the genetic health of the developing fetus. Genetic counselors can help interpret the results, discuss the potential implications. So thank you for patient listening, and for further queries, visit nearby Momstory.